I'm super excited for our special guest today, Mary Fusillo. She has her own company. She has an agency. She is a former fertility nurse. And it's going to be such an incredible conversation because she can answer just about any question. She can answer questions about an IVF cycle, surrogacy, trying to achieve success without IVF. So Mary's going to be joining us in just a moment. This is our first time doing an Instagram live together. So please be patient as she takes a moment to request joining. She's got a staff member kind of helping get her situated for that. And I'll tell you that, she's been in our field for so long. So she's incredibly well respected by IVF clinics that she works with. She has worked with a lot of surrogacy cycles, egg donor cycles. She also does kind of personal fertility concierge. So she does a lot of some of the similar things that we do at the company, but she does it at a level of expertise and kind of hand-holding throughout the entire cycle or throughout your entire journey that sometimes is really warranted. Okay, another question came in from Carolyn Lyons that she's been dealing with secondary infertility and she's had 2 failed transfers. So she has a last frozen and, they want to give it their best shot. And she's asking about, your take on embryo, getting the embryo to stick with glue, with doing a scratch beforehand. I think it's also a great question to ask Dr. Chen on Mondays, but I think since you've been a fertility nurse in the past, you saw, you probably followed the trends. Like, what have you even seen with your patient population work?
Okay, so one of the things about IVF is that I've learned over my 20 years is everybody's looking for the golden unicorn that's going to make the embryo stick.
Right.
And we go through trends. I remember we went through the Viagra trend where we're going to take Viagra to increase our lining. The studies show, and I
had no idea about that one. I did not know that one.
Oh, you know about Viagra?
Oh my gosh, I had no idea.
They used to have Viagra vaginally to the woman, just to the woman.
Oh my gosh, I didn't know.
And supposedly it was supposed to increase blood flow to the uterus because, if it increased blood flow to the penis, it must increase blood flow to the uterus. No.
Yeah, different biological pathways for increasing blood flow.
So, but a lot of people swore by it. But one of the things about the endometrial scratch, the embryo glue, none of them have been shown in studies, mostly out of Europe, that they really work. I mean, some clinics swear by them. I think it's just another way. It's kind of like all the add-ons. Okay. So for instance, I just bought a new car and I live in Houston, Texas, and they asked me if I wanted heated seats. Why would I want heated seats in Houston, Texas?
Because you just took your brand new car to Vail or somewhere that's cold.
Exactly, right? So that's the kind of the same thing. Hey, do you want us to throw in the glue and the scratch? And one of the big clinics that was big advocates, I won't name them, for embryo glue, quit using it quietly about a year ago. If it was my last embryo, I might throw everything but the kitchen sink at it. Right. But I don't. But
go into it being realistic. Yeah, it's not going to hurt, but studies haven't proven that it actually does help. Right. But I agree. If it's your last embryo, and check in on your lining. And again, if you want a second opinion, Mary's a great person to do a consult with. She can review the entire case. She has an extensive network of experts that she works directly with as well that are tried and true. We've got Brittany who had baby number 1, no problem. And then she had very awful postpartum. So first, I just want to acknowledge you, Brittany, how hard that is. I actually was at high risk for postpartum depression because I have dealt with anxiety and depression in my life. And so I kind of headed into that phase being really nervous about it and proactively started medication as well, just because I was so nervous. She's on venlafaxine. Did I say that right? She's been trying for 2 years now, is concerned that her antidepressant is the problem. There are medications that are contraindicated to pregnancy, but Mary, I've never read a study that indicates that an anti-anxiety or antidepressant is contraindicated for conceiving.
No, I haven't heard it either. And we get the question a lot. I think that for the most part, especially like with our surrogates, we don't want them to be on any medication just because of a myriad reasons why. But if it's, for your own child, I think your mental health probably takes precedence.
Yeah, absolutely. And there are medications. I sat in a conference where a group of OBGYNs were presenting that there are medications that are kind of better for pregnancy, but I have never read a study that any medication would be the reason that you're not conceiving. So I would encourage you, though, if you haven't done it already, Brittany, one of the things that we really advocate for and that Mary's here to support is getting a full workup on you, really making sure that you have proper diagnostics. And one of the things we see repeatedly in our Instagram community and on the Fertility Answers app side is kind of a bottleneck with generalized care, with the OBGYN care. They have their suite of tools, but then the REIs have their suite of tools. And it's not because you necessarily even need IVF. It's just because we advocate for you having a proper workup with all the complete diagnostics to quote unquote look under the hood, so that you can, so we can make sure that if there is a problem, that you would be able to access the solution. But definitely, taking care of your mental health is self-care and really important. So I just commend you for taking care of you and making sure that that you're doing all the right things. Let's see. So Jasmine's husband had, I always say this word wrong, varicocele. Did I say it right? Varicocele surgery in May. No improvement, though, in the sperm count or motility. So now they're looking into IVF. So should they have expected, an improvement? And, maybe
I think it's a little, there's a couple of caveats about that is, number one, it hasn't been a long time yet. I would suggest looking at other factors also before they go to IVF. I would look at adding in some supplements. Not necessarily. There's a lot of stuff on the market that is over the counter that can help. Make sure you're doing the whole boxers versus briefs, correct exercise, and stop the alcohol. Period. Okay. As much as it's very stressful right now,
right?
The world's really stressful. So I would kind of wait maybe and don't go to IVF for at least 6 to 8 months after having the surgery.
Gotcha.
And doing everything you can think of to lead a healthy lifestyle. Like we can all be de-stressed right now. We can always look at somebody's medical records. That's what we do. We'll do a consult. I'll look at their medical records. I'm not a doctor, but I've seen hundreds and thousands of medical records and kind of say, hey, you may want to look at a urologist again before you go straight to IVF.
Right. Yeah. Great. That's great advice. And definitely no weed. Weed is like, sperm killer. So,
weed,
vaping, no vaping.
Weight can be a real factor.
Yeah. Yeah. Awesome. Okay. That was great advice. And then Hina says she's feeling well. She just did her egg retrieval, feeling well, just some bloating. And yeah, I remember I had a horrible bloat after my egg retrieval. I just felt like there was a lot going on there. So I'm glad that you're feeling well. It's live. We're live. Okay. Surrogate UK says hi. Somebody that you know maybe already. Okay. Mayra wants to know, is there what's the approximate cost for PGS testing? I don't have those current costs. I know that it's quite variable.
I'd say what I'm seeing, because we try to get estimate, it's between 2,500 and 4,000 up to 8 eggs or embryos is what the general rule is. And and then they add it on. If you have more than 8, you'd pay it by embryo.
Okay, got it. And then let's see, Polly, very high DNA fragmentation. Any ideas to reduce DNA fragmentation?
Not off the top of my head. That would definitely be a true physician question.
Yeah. Alexandra, so you can pop back on Monday to talk to Serena Chen about that. We're also going to have a urologist on here soon. Alexandra, great to see you again. Just saw you yesterday. Recovering from second IVF. She's been dealing with a loss and a 7-week loss. And she was prescribed 1 Lovonix, aspirin, and methylfolate with B12 because she did MTHFR, I believe, from yesterday's show. Should she ask for intralipid or more Lovenox? No? Okay.
I wouldn't with this one thing. I mean, like I said, I'm not a physician, but what she's on is like really the best protocol. Especially with that diagnosis, I definitely give that a whirl before I, start adding anything else. That sounds like a perfect combination.
Got it. Okay, good. That's good. And see, sometimes that's just enough, right? Where you like get the confidence from being able to talk to somebody like Mary, where it's just like, okay, I'm doing everything, all the right things. And almost, I think I said that right. Coming to us from Melbourne, Australia. She has one embryo left too. We have all these like one embryo left. It's like nail biting. So similar question, like what can she do on her side to like set herself up for a positive transfer?
I would say, when I first started in fertility 21 years ago, I was very scientific. Everything has to be scientific. But I've kind of gone the other way, as I call, a little more woo-woo. And I've seen, especially with our surrogates, we get a lot of people who have one embryo with a surrogate and are like, even when I talk to people on the consultation side, I would say I really am a big believer now in acupuncture. I think acupuncture and the relaxation and literally live in a pineapple field. Okay. Like live in the pineapple field, eating pineapple all day long, maybe just go to, Hawaii and eat pineapple. Those two things, I think, especially, and a lot of relaxation. I think that sometimes, who knows, but the uterus is like so sensitive to all this, and hydration. I know everyone's heard this, the pineapple, hydration, yoga, all that, but I think, it couldn't hurt.
Yeah, right. That's great advice.
Mm-hmm.
Yeah, we are huge advocates of acupuncture, huge, and I love seeing the research studies come out in support. But I think, Dr. Raquel and I on Tuesdays are always like, give me some acupuncture, just because there is such a deep relaxation that happens that, that it just feels so good. So doing all the things that make you feel good, that are healthy things to do. Because
I've seen the last one I saw that was a success story. They had done acupuncture during the, before the FET, before the frozen embryo transfer, i.e. leading up to it. Okay. Mm-hmm. But the day of the transfer, she went right before the FET, bladder full, the whole 9 yards, and then immediately went and had her embryo transfer. And so she really feels that last minute, the last time really made a difference for her.
That's incredible. Lynn's just had a miscarriage 7 weeks ago. I'm so sorry to hear that. It was, and she made it to 15 weeks. So that's got to be just absolutely heartbreaking. I had 5 losses. They were much earlier than yours, and it's so painful. Thank you for sharing that with us. Her HCG was a 10 last week. When she retested 3 days later, it was still a 10. Is that normal? And also, is it possible to ovulate if HCG is not at 0?
Yes, you can ovulate if your HCG is not 0, because people have a lot of Irish twins out there, and so they still got, they still have that going on. It's almost there. Sometimes the testing is not 100% accurate. Somebody could have a 10 one day and 9 the next and 11 the next. So usually if you wait 2 or 3 weeks, it'll go down to 0. Got
it. Okay. And then Macy Fetzer, she had 3 chemical pregnancies back to back. And she does have an 18-month-old and a 4-year-old. If that wasn't happening kind of in between the two children, doesn't that count as a recurrent pregnancy loss, and she should get an RPL workup? I would say the very first thing I do that is the low tech or low cost thing is to see if something's going on with her progesterone level, and to see if, especially if she's having it at the same time, maybe just throwing in some progesterone at the next, if she's being able to conceive literally on her own, then maybe she needs some progesterone. Okay? Right. And that would be something I'd ask my OB about. The OB. Yeah, exactly. Yeah, right, exactly. Now we do have the Uva.Life at-home kit to measure your actual progesterone level to confirm that you've ovulated. Wow. So you could use that. I know, it's so cool. It's a quantitative level. So it's literally like a beta HCG level, but just for ovulation confirmation, because you get that quantitative. So that could be a really useful tool for her as well, because she could, at least at home for the next 2 cycles, see if she's producing progesterone at a level that is it isn't indicative of being a low producer.
Well, and the
during
other thing about
ovulation.
progesterone is it's a cyclical hormone. So the one that you have at 6 a.m. is going to be different than the one you have at 6 p.m. So if she's going to use a kit like that, which is really meant for ovulation, not to see if her hormone is dipping, she's going to want to do it consistently at the same time.
Yeah, exactly.
Okay.
And that's actually with all the kits. I mean, we always advocate that, like whatever kits you're using, make sure that you do them at the same time of the day. Now we have, let's see, zucchini. That's such a cute little handle. What can you tell us about the success rate of using letrozole to ovulate? So, being letrozole for superovulation.
I would say, is that a PCOS person? Maybe that sounds like what happens with PCOS. And I think it's the first line of defense. So you definitely want to try it. It's a lesser expensive course of action.
Right. Got it. That's great. That's all the questions that we have. So let's, Zucchini said, yes, she has PCOS. So that makes sense.
Yeah.
Yeah. Sometimes letrozole, sometimes Clomid, sometimes, and
letrozole seems to now in this world and today, back in the day, I had PCOS a long time ago. I mean, well, I guess you never get rid of it, but
right. You still have right.
Yeah. So, Clomid was the thing, but the thing about Clomid is a lot of the OBGYNs just keep doing it. Okay. And so like a year goes by, now your ovaries are nothing but cysts and it's a mess. Whereas it's different with this. So I think it's a good first line of defense.
Right. Yeah. And that's a really good point. We always advocate that, that folks don't go past 6 months. If they're doing Clomid, and also because we see the greatest success happens the first 3 cycles anyway.
Right.
So that's important. So Mary, how can everybody connect with you further? So they can follow you at the Fertility Consultants. They can ask you questions on the Fertility Answers app, and then they can book a consult with you directly from the app too. What's the website?
The website is thefertilityconsultants.com.
So great. Okay.
And one of the things that what I wanted to bring to this was, yes, I've done donor egg, I've done surrogacy, I've done IVF for all these years, but so many times people have these kind of questions. So we offer a 20-minute complimentary consult just to kind of go over.
Great.
Some people have things. I've had 3 miscarriages, blah, blah, blah. And then, I just get a little bit more information. The thing is having, never to supplement your physician, but sometimes it's something that the physician wouldn't necessarily think of because, for instance, people always are going to the OBGYN. The OBGYN sees pregnant people all day long. And then all of a sudden comes the zebra who has a fertility issue.
Right.
They don't see that versus the fertility doctor. Everybody has infertility. So you kind of need somebody to say, hey, I think this is an OB issue. And this is kind of what you need to talk to your OB about. Maybe ask these questions.
Yes, that's great. And that's what a generous offer too, that you can have 20 minutes, with her complimentary. That's
really
incredible.
Fast. So it's really like 30 minutes.
Fast. Somebody asked where you were based, and because every time I talk to you, you're in a different state. I couldn't remember if it was Houston or not, but are you
Houston?
Right. Okay.
Houston. Yeah. And
that you help people all over the world.
Right. Yeah. So we do people everywhere. It's just a time. People are like, they'll call at the wrong time, but we have on our website, the Fertility Consultant, we have and it's for fertility consultants with the S on the end. We have a link to, you can self-schedule yourself and all the available times are there. And it's, if people need more than the 20 minutes, we either have a package. You can say, okay, I want somebody to review my medical records. And my goal on that is just to help you find the right avenue.
Oh, wait, we did have a couple more questions coming in before we wrap it up. XOXO Providence. Yes, she's asking a follow-up question about something that came up yesterday. And this is for sure something Mary can clarify too. With PCOS and a high level of AMH, we were cautioning about the risk of multiples with Clomid. That because it's a super ovulation drug, it is a lot of times you release more than one egg at a time. And if you release more than one egg at a time, then, more than one egg can be fertilized. It's kind of why we say no sex right before an egg retrieval, just in case you ovulate before the retrieval.
Right. Yes.
Yeah. So yes, I hope that
it is
clarifies.
less. It doesn't happen as much as you think it does. Especially with it doesn't. It really doesn't. I mean, I actually see less people with multiples from Clomid than I do with just a regular old-fashioned IVF cycle where they split, just because of the fact that Clomid, especially for PCOSers, it's you
Mm-hmm.
aren't releasing. You end up. That's the problem, is you don't release.
Right, is you're not ovulating.
So the
Exactly.
Clomid, there may be a ton of follicles on your ovaries, but
Right.
maybe only one is going to release from the Clomid.
Right. Okay. And then let's see, Dayan Lee Lady D, she's had 2 miscarriages. I'm so sorry to hear that. She's been trying for a year and a half and it doesn't happen. Well, gosh, so the pregnancy's happening, the losses are happening. I just feel like with 2 miscarriages, get a workup.
Well, I think it would depend on 2 factors. The age, okay? And then I would start with, I'm very cost conscious. Okay. So I say, let's start with the most low tech thing you have. So you're having losses. When are the losses? Are they right at 6 weeks, right when you're just peeing on the stick and you find out you're pregnant? Or are they later on? And those could be 2 different things. Chemicals can be, back to the progesterone question we talked about. That could be progesterone.
Right.
It could be, they could also be genetic. So sometimes if it's early, they can be genetic. If they're later, 7 or 8 weeks, it could be genetic, or they could be uterine issues. Like you maybe have a hidden fibroid you didn't know about, something like that. So I always say the very cheapest and easiest thing to do is to get a semen analysis, because then you've ruled out 40% of infertility, because you could have a problem with the sperm that you wouldn't even know. You may have. Does that make sense? So that's it. It's a
Mary, I love that advice so much, because I think that as women, we're like, it's us. And when we're so proactive, and I don't think anybody's ever said that on our shows before, is like, wait, this is the cheap and easy thing to do, is first rule out 40% of the potential. That's really great advice.
Tell you, in my days of doing this, I can't tell you how many people went through the poor woman having like the HSP where they shoot the dye and then jump off the table, and they do all this stuff. And the guy, I mean, let's serious guys, you get to, you know what, and then you hand somebody a cup. I mean, it doesn't hurt.
Right. Exactly. They can even do it at home these days. So, I mean, there are so many at-home collection kits on the market right now. And I mean, so many. I think I found out about it yet, another new company too, that entered the market. So she's unfortunately only 22 years old, so that's just heartbreaking. So
I would definitely do the first line, especially at that age. I know it's a little different. Maybe you're not as, have as much economic fortitude as somebody who's a little bit older. So you want to start with the least expensive thing. And then after that, I would say definitely talk to your obstetrician about checking your progesterone, or even because you kind of want to see what they think also. Do you have a fibroid? Do you have lining issues? What's going on?
Right. See, great advice, Mary. Is very empowering talking to her, because she sets you up with even what to ask your OB. XOXO Providence has another question. Can you see if there are multiple eggs before the conception days?
Yes, on an ultrasound you can, right?
Yeah, you have to get into the clinic. So
you're going to see how many follicles, but that doesn't mean that that's an egg, because not every follicle has an egg.
Yeah.
And so hence you can say, hey, you maybe have 10 follicles on each ovary, but are they the size that's going to release that egg?
Right.
If you're taking medication. If you're not taking medication, you'd only hope to see 1, maybe 2.
Yeah, got it. Dan Landy's just saying thank you so much. She was really worried that something was wrong with her. And I think we all do, like, we're just, as women, I just feel like we just very quick to be like, what's wrong with me? And so let's stay in touch too, and follow you throughout. Kyra Joy is asking, can you still have a successful pregnancy with a uterine polyp?
Yes. But it depends on how big it is. I mean, if it's microscopic, probably not. And it also depends on where it is. I have to say, is it at the top? Is it at the back? Is it at the bottom? So where is it? Okay. So bottom line is, a lot of times we get, especially people that are on long-term birth control, sometimes they will get polyps because the lining doesn't shed like it will regularly. So you end up with this little tiny, it's almost like a skin tag. So some OBGYNs, they're not like a big thumb or anything. It's like a little tiny skin tag. And if that embryo goes to implant there, then it's not going to be able to implant. So it's kind of a gamble. Most of them can be taken out in the office. in the doctor's office. It's just a little squishy and, you know, under ultrasound guidance if it's big enough.
Right.
But for the most part, people going through IVF, they're going to want it taken out because you just spent all this money.
Yes, exactly. And they want like the most pristine environment to work in because it's science and art.
Right.
So,
but it's not something where, honestly, unless it's like a thumb,
right.
if it's a little tiny and if it's
Right.
not anywhere where implantation usually happens, then I think you could be probably okay.
Mhm.
Especially if it's a monetary factor and it's not going to be covered by insurance.
Right. Okay, a couple follow-up questions, and then we're going to wrap up. Mary's been so generous with her time. Let's see, Lynn's follow-up question with her 15-week miscarriage. She did do all the genetic testing, thrombophilia testing, blood work, all came back negative. Is there anything else she can do to hunt for a reason? She must have. See, here's the thing: is that a lot of the genetic testing on the fetus is still limited. It's not like a full, genome panel. There's a lot of variability, and so sometimes it's something that you just didn't happen to test for. It doesn't mean that there was nothing genetically. So I think that would probably, warrant maybe a little further review with you, right? That would maybe be a good 20-minute
say
conversation.
Also that, and I know just from being a women's health nurse for so long that unfortunately it happens and people don't want to necessarily understand cord accidents do happen. Cord accidents happen at 15, 16, 18, 24, 28 weeks. A lot of times when they're unexplained. The other thing that I think that people that should do preconception is be genetically tested themselves.
Yeah.
So if the husband and the wife both get or the two partners get genetically tested, then you're going to have a backdrop for what could happen. And you're right about the fetuses. I mean, they only do a small panel on them.
Right.
And at 15, 16 weeks, you would have already had a demise from other things.
Right. Okay. All right. Couple more questions, everybody. And we're going to wrap up. Monique is asking, is anything to help ovulation after a myomectomy and endometria removal from an ovary?
So to increase the lining, was that the question?
I think to help ovulation. Yeah, to help ovulation.
No, I think that's, you're doing what you can do. You had things fixed, something on your ovary, something in the uterus. As they say, the healthy living is the best thing you can do. Right.
That goes back, to the healthy living. Lauren, always good to see you. Thanks for hopping on again. She's asking a question: when you have ovary cramping, how long after do you ovulate?
Okay, that's called Mittelschmerz. I love that word, Mittelschmerz. Okay?
I've never even heard that word.
I
learned 2 new things from you today.
Yeah,
I love
Mittelschmerz.
it.
And Mittelschmerz, certain women have it, certain women don't. Okay, and Mittelschmerz happens literally, it's when you're ovulating. It's like that is the pain as the egg bursts out of the follicle. So literally, that's when you say, "Come on down."
Exactly. So like, get on it, Lauren.
That's what it is.
Get on it. Okay.
And you really you don't feel it on one side or the other. It kind of tends to be midline because your ovaries are so low down in your pelvis that they're only this far apart. You wouldn't feel it one ovary or the other ovary.
Got it. Okay. All right. Great. Well, thank you everybody so much. This has been incredible. I learned so much. I was kidding about only learning 2 things. I just learned about 15 from Mary on this. We are definitely going to have her on again. Let us know in direct message if you need the URL, to send over, but it's thefertilityconsultants.com, correct?
TheFertilityConsultants.com.
Yes, TheFertilityConsultants.com. Yes, it's
TheFertilityConsultants.com.
Exactly.
And, complimentary 20-minute consult, and no question is off limits. And if I don't know, I will tell you.
Yeah, that's great. Okay, awesome. Well, thanks everybody for joining us. If you have another question for Mary that we didn't get to cover, please DM it to us. We'll make sure that she gets it. And you're welcome as always, Lauren. I love seeing my repeat, community come back. We're so grateful for you. Don't forget that if you're not on the app yet, Fertility Answers, iOS or Android, get on it, register, because we can connect you with so many reduced fee discounts on things, and connect you directly with Mary that way as well. And thank you, Mary, for your time. It's been incredible. And I'm so glad we worked out the tech issues.
Oh, yeah. Bye, guys. Thank you.